How you doing, everybody? All right, so here today to talk about Australia. Bit of background on who we are and what we've done thus far. We are a Canadian-based company, privately held as of today, based out of Kelowna, British Columbia. Operate in the medical space in Canada under the Compass Cannabis Clinics brand, and under the retail space under the Starbuds brand. As always, forward-looking statements and everything we're going to apply here. So a bit of background on what we've done, how we've got to this point as a company. So under the Compass Cannabis Clinics banner, we've signed up over 8,000 patients in Canada over the last 11 months. Vis-a-vis that, we've signed Teresa Topic as our Chief Medical Officer, and we'll talk a lot more about her as we go on. But one of the global faces of the medical cannabis world. And alongside of that, her platform, Mediwana, which is Australian-based as well. First accredited platform that we believe on a program that allows other physicians to earn ongoing education points. So what this means, you require 50 points to stay as a physician every 3 years in Australia. To learn about cannabis prescribing, you have to take her course. So we now have a lead into teaching other doctors the systems of cannabis and ultimately becoming the main source for education for an entire continent. Leading prescriber in New South Wales, so currently she operates as a general practitioner. She's got more than 5% of the patients in the entire continent right now under her, and this is as a mixed-use medical professional. In February, our first clinic will launch where she'll be strictly in the cannabis space, both taking in new patients and ultimately educating physicians. Ability to approve authorized prescribers. So to prescribe cannabis in Australia, you need to have a check mark. She's the one that prescribes that check mark. So ultimately, any physician that wants to prescribe medical cannabis gets in front of Dr. Topic, talks about the ins and outs of that business, and she's also a member of the Board of Ethics. So highly ethical, good tie-in with the government, and that Board of Ethics, beyond approving new products, also improves ancillary products. So if you think of medical devices such as vaporizers, things of that nature, she is part of that approval process as well. So where are we going? First clinic will open in Sydney. Soft open will be the tail end of February. That will be we're terming it a lifestyle clinic. Cannabis clinics is not as socially acceptable in Australia as it is in Canada today. The only difference that will present versus what we've done in Canada, it will have ancillary services, psychiatrists, chiropractors, massage. Ultimately, it's small revenue streams for us, but it does bring patients in the door because really right now we're in the patient access game. There's 2,000 patients in Australia. If you look back a year ago, there was 60 patients. So we're on a sizable hockey stick curve. But ultimately, we want it to feel like a laid-back clinic to some extent. Somewhere in a new country, someone's comfortable to talk about cannabis. Now, why is cannabis a growth market in Australia, and why do we see this really as the low-hanging fruit for value investors? So ultimately, right now, there's 38,000 general practitioners. Only 33 can prescribe cannabis as of today. So by partnering with the physician that actually allows other doctors to prescribe cannabis, we see that as a good entry point. In terms of patient count, there's 2,000 patients in Australia. This is a small number, but comparative to Canada, and you put it up year-over-year basis, it's growing much quicker than Canada did in the early stages. And ultimately, Australia has a very similar model to traditional pharma. So this would be entries into pharmacies where we can put our cannabis products. It is not like Canada where you're direct order through your licensed producers. And realistically, demand is off the charts there. There's very little cannabis access in that part of the world, but it's certainly coming. So we see ourselves as having a good early mover advantage. There is a single cannabis clinic open in Australia today. Given that we are one of the largest cannabis clinic networks in Canada, we believe that we have the skills that transfer over quickly. And we've got, again, a wait list on patients already. We're into several hundred waiting to see Dr. Topic. Similar to Canada in terms of laws, it transfers over well. It's a very similar culture to Canada, so we believe a lot of the pieces that have worked in Canada transfer well into Australia. And this would also include some of the partners. So if you look at who's investing into Australia from Canada, these are the biggest, in some cases, NYSE traded stocks, but generally all TSX listed guys, and the biggest market caps we have in our country. So we have a natural tie-in with many of the providers already there. And what you're seeing in terms of ultimately cannabis access in the Pacific Rim, we've got New Zealand coming up with a legalization vote on the recreational side in 2020. Australia has significantly reduced their barriers to entry from the medical side. And we're seeing that across broader Asia, Thailand, Malaysia. Places that literally would have hung you for cannabis a year ago are now having medical programs. So we're seeing a very quick adoption. And in terms of ultimately populations you want to gain access to, the Pacific Rim has Japan's and China's. For perspective, Tokyo is bigger than Canada for population. So really it is a very underserved market, but ultimately we think the biggest opportunity on the globe. The other important piece in Australia, you have a very fragmented population there, where you've got major population bases, Sydney, Melbourne, etc. But you also have a very sparsely populated center of the continent. By having telemedicine access there, it does gain us access to those patients that don't need to travel 6 to 10 hours to come see a physician. When we talk about Canada, this will give you an idea of what's happened in the last 3 years. Patient count now has got so high, Health Canada has stopped releasing these numbers. But when I talk about 2,000 patients in Australia and being Canada 4 years ago, where is it going to end up going? Well, we were 350,000 patients at the last release numbers, and that continued to grow substantially. And I can talk even post-legalization in Canada, the busiest 2 weeks that we've had as a company were the week of legalization and the week post-legalization, because in general, your grandparents and your mom and dad decided cannabis was now acceptable as medicine, and they were willing to come see a physician. So it was no longer a younger generation. Our generation that we're now seeing the highest growth is certainly your 80 plus. But ultimately 50 plus is growing extremely quickly in Canada, and we do suspect that's going to play in our favor when you look at the demographics of Japan and China, which ultimately we want to use this vehicle to enter into. In terms of how do we make money in this business, ultimately access to product is the most important piece for us. So exporting via Canada, GMP certified products. Australia is an oil-based country. We do suspect flower will be acceptable there at some point in the near future. We have a partnership with the first licensed importer in Australia. So this is access to all the pharmacies on the continent. And he's done the literal first deals, access from Canada into Australia. But he also speaks the language of pharmacists. So when we talk about why is this medicine, why would you carry it in a pharmacy? Again, it helps to break the stigma. Australia also has ability to export. Our pharmacist is tied into New Zealand, is tied into Japan. So ultimately, we do see this as a launching ground for further products in the Pacific Rim. In terms of who we're working with, generally these are major Canadian groups, mostly focused on extraction, oil-based products, initially launching a 1-to-1 product and a high CBD product, oil-based. And we look for white label opportunities. Beyond being the clinic network, we also want to be the product. In terms of the training section, by having the first accredited program in Australia, we feel like we have a sizable jump on other physicians and other networks trying to enter that country. We do believe other Canadians will see this as an opportunity, but if we are training the physicians, we can ultimately train them on both everything regarding medical cannabis, but also our products. Why do we have the best products? We're using GMP certifications. We're using the best of breed in Canada from the extraction side of it. So on the white label, we've got a brand called North. We're going to enter with that as one of them. And we are working, again, on the extraction side. Generally, there are some very strong white label Canadian companies. I'd suggest 2 of them are in this room or at this show today that you may be able to have discussions on. And for the metrics of it, if we buy it for $1 in Canada, we're selling it for $3 in Australia. So it's a sizable market. It's the reason you're seeing a Canopy, for example, focus on the export market versus focus internally in Canada. Part of the supply shortage we have there, prices on the international side of the business are much higher than we get in Canada. Where else do we see ultimately medical having a piece? New Zealand certainly is one. By having our retail arm, we do intend to plant a flag there and seeing that as a 2020 opportunity, but we do see sizable opportunity within the EU, within Japan. Again, this is via our network of pharmacists and physicians. They have access to these other countries, but even being in this room and at the mixer last night, having discussions with groups out of Brazil, for example, asking about how do we get clinics in Brazil? How do we train physicians? This is a worldwide opportunity that is in the very, very early stages. And via all of our different networks that we run, both our clinics in Canada, retail in Canada, our partnership with our retail arm in the US, really changing the perception of cannabis. We feel, again, this is still early stages. It's an educated group that's in this room. They see the opportunity, but there is still sizable stigma that exists, and there's a sizable group of both customers on the retail arm and patients on the medical arm that ultimately will see the benefits of cannabis on a go-forward basis. So capital that we're raising, this is a similar structure to what we did in Canada. 10-cent shares, we're raising $4 million in capital. The ownership group involved in it is Compass Canada, so that arm, as well as Dr. Teresa Topik, so our physician. And again, reason we're looking at this as a spin-off, we see sizable opportunity on the ASX in Australia. And ultimately, if we do intend to move forward into the